Hemorrhage, also called bleeding, is the escape of blood from the body. Bleeding can be very subtle, like after a little cut, or profuse after a big injury, like a car accident. Bleeding can happen anywhere in or on the body. Again, hemorrhage can happen anywhere in your body. However, based on location, it can be more or less obvious. If less obvious, it might take longer to diagnose the bleeding. Less obvious bleeding can also cause injury in addition to the bleeding itself, as it takes longer to diagnose. For example, bleeding in your brain might not be immediately obvious. However, since your skull surrounds the brain, blood has nowhere to go and will push on your brain and cause a potential life-threatening injury. Hemorrhage can be internal or external. An example for internal bleeding can be bleeding in the abdomen due to a ruptured appendix or a bleed inside your leg after a leg injury. External bleeding is usually seen after skin cuts or a scrape, but can also appear after a larger injury to the arm or the leg and can involve ruptured blood vessels. The most obvious sign of bleeding is bleeding itself. However, bleeding can also happen internally and not be so obvious. There are many non-obvious signs and symptoms of bleeding. One, for example, can experience symptoms like tiredness, fatigue, dizziness, nausea, skin discoloration or swelling, pain, a fast heartbeat, sweating, and skin paleness. A healthy person can actually lose up to 50% of their blood volume before severe symptoms occur. Severe symptoms of bleeding can include an abnormal low blood pressure, fainting, and unconsciousness. Hemorrhage is not always immediately visible, especially if it's internal bleeding. It can go undetected for quite a long time, especially in the absence of any obvious trauma or injury. However, unusual pain or discoloration of the skin can be an important clue. Your body has the natural ability of stopping a bleed on its own. Bleeding from small cuts and bruises stop within minutes, if not seconds. Larger bleeds that involve blood vessels or blood-rich organs, like your liver or spleen, even with normal coagulation function, might not stop on its own. To stop this type of bleed, surgical intervention is usually required. Any unusual and unexplained symptoms should prompt you to seek emergency care, but especially if an obvious injury occurred. However, as discussed, bleeding can happen spontaneously without any obvious reasons, so it's always wise to seek emergency care if you're feeling unwell. There are many different types of hemorrhage or bleeding, which are usually named after the body parts where the bleeding occurs. These can include the following. Subconjunctival hemorrhage is bleeding behind the eye due to a ruptured blood vessel. Hemorrhagic stroke is defined as bleeding into the brain due to a ruptured major blood vessel. Subarachnoid hemorrhage is bleeding in between the protective layers of the brain, also due to a ruptured blood vessel, usually after head trauma, but can also occur spontaneously. Brain hemorrhage is defined in general as bleeding into the brain. Subchorionic bleeding is bleeding between the uterus and the gestational membrane surrounding the fetus. Post-Partum hemorrhage is defined as bleeding that occurs after delivery of the baby. Maternal hemorrhage is a broad term for bleeding that occurs during pregnancy, but is usually seen during or after delivery of the baby. Any type of bleeding can range from minor, moderate to severe bleeding and needs to be attended to by a healthcare professional in order to diagnose and treat the bleeding and its underlying causes. Treatment of hemorrhage or bleeding depend on many factors. These include the underlying cause of the bleed, the type of bleed, and other comorbidities a bleeding patient might present with. Also, sometimes we treat patients with known underlying bleeding disorders before undergoing a procedure preemptively to avoid bleeding. Mild bleeding due to cuts and scrapes can be controlled by covering the injured site with a clean towel or dressing and apply pressure. The pressure will aid your body's natural ability to control the bleeding. Bleeding should always be attended to, as even minor bleeding can over time lead to major blood loss. Once there is a large amount of untreated blood loss, your body goes into shock. Shock due to bleeding is caused by an imbalance of oxygen supply and demand. Since blood carries oxygen to all organs, a reduction in blood flow due to bleeding causes a reduction in oxygen supply. Treatment involves correcting this imbalance, which starts with stopping the bleeding, diagnosing the cause for the bleed, and often also includes blood transfusions, fluid administrations, and supportive care. Blood carries vital nutrients for your body's proper functioning, like oxygen. Without blood, there is no oxygen, which means many vital organs can shut down. Therefore, not attending to even minor bleeding can cause potential life-threatening long-term side effects.